Thank you, Chairperson. Give me opportunity to participate this COVID-19 pandemic and various aspects associated. Madam, from the very beginning of the pandemic back in 2020, the central government was unable to contain, incapable to restrain, and careless in controlling every aspect in governing a crisis as dangerous COVID-19 pandemic, which affected the nation in its public health frontiers, socio-economic sectors and aspect of welfare of Indians affected by the pandemic and the poor policies of the government. Ever since India first COVID-19 patient was reported on January 30th, 2020, we can see government that panicked and went from one state to confusion another. It was found unable to handle a global pandemic. The government decision to enforce a random and misinformed lockdown that saw the devastating sight of an exodus of migrant laborers embarking on a long and perilous journey on foot. The migrant workers walking thousands of kilometers, often without food due to the absence of any mode of transportation, and succumbed their fate as there was zero government. In the empty highways, where life had been brought a halt without notice and the migrant laborers left at their own. The situation changed after the impassionate appeal and intervention made by Congress President Srimati Sonia Gandhi ji and Rahul Gandhi and Priyanka ji, whose continued intervention forced the government to finally provide the alternative mode of transport. The devastation left by the pandemic in the first wave itself destroyed economies as every sector, from micro to small to medium and large industries suffered losses, and many small-scale industries and traditional sectors vanished overnight. In the period of the first wave of the pandemic, from April to June 2020, India's GDP by a massive 24.4%, and second quarter 2020-21 financial year, July-September 2020, the economic contracted by further 7.4%. It is also important to note that the post-independence period, India's national income has declined only 4 times before 2020. In 1958, 1966, 1973, and 1980, and 2020-21 is worst year in terms of economic contraction in the country's history, madam. Furthermore, the government decision of implemented 20 lakh crore Atmanirbhar package, claiming to be 10% of the GDP, was an eyewash and statistical circus. In a reality, the government would not be spreading more than 2 lakh crores of package. And moreover, there was no provision for direct cash transfer to the distressed and poor or the laborers. Madam, in the first wave of the COVID was disastrous. The second wave witnessed massive loss of life and absolute destruction of livelihoods and sectors of economy. According to the analysis of Center for Monitoring Indian Economy, over 10 million Indians have lost their jobs because of the second wave of COVID-19, and around 90% of the householders have faced income loss since the beginning of the pandemic last year. The unemployment rate in the country touched a 4-month high as locally implemented lockdown in many states have impacted over 70 lakhs jobs. If this was the situation in the economic sector, the loss of lives in second wave of the COVID was horrifying. India's official COVID-19 death count by the end of June 2021 was 4 lakh, and report authored by the India former Chief Economic Advisor, Shri Arvind Subramaniam, stated that true deaths are likely to be in the several millions and not in hundreds of thousands, making India's worst human tragedy since partition independence. So the deaths were unrepaired during the second wave, and even when such things happened. The frightening sight of the dead bodies floating the river Ganga and Yamuna and bodies getting dumped into rivers shook the conscience of the nation, but not this government that was unmoved by death and destruction. Madam, the failure of vaccinate on time, the confusion created by denying states the right to take up vaccination effort, and the government finally reverting the right of vaccination process created a confusion and chaos in administrating vaccine at critical time. The decision to play the savior of the world was at the cost of the nation and her citizens, as they were left without vaccination, and government, instead of listening to opposition, decided to complicate things further. The shortage of oxygen was the horrible incident that exposed the central government and stubborn refusal to take adequate precaution in helping states with the necessary equipments and oxygen concentrators. Madam, the nation saw deaths in large numbers as people begged for oxygen, and nowhere in the country medical oxygen was available. This situation could have been avoided. The government had listened to even the Standing Committee on Health that flagged the shortage of oxygen concentrators and oxygen plant in the country even after the first wave. Madam, in my state, Kerala, the Kerala government is now adding deaths that were caused. The spread over the still not controlled Kerala state with the failure of control the pandemic. But do everything, create public relation exercise, keeping adding more cases in the total cases per day in the thousands. The only activity engaged by the Kerala government was to cover up the death rate and present a false picture of resilience and create fake narrative with which it won assembly election, ma'am. The Kerala government is now adding deaths that were caused by COVID infection, and it kept concealed and hidden from the statistical figure, with each day in admission of his wrongdoing manipulating numbers. In the matters concerning Pravasis who were severely affected by the pandemic, I urge the government to engage the following. Madam, the package for rehabilitation of Pravasi returns who lost their employment and are under crisis, and package with the funding of Government of India must be created, and Pravasi supported in their hour of crisis. Madam, the salaries benefited the various Pravasis who returned in between India or passed away due to COVID are yet to be reimbursed the rightful elements, and their benefits are pending with their host nations. Their families and beneficiaries must be helped to recover such areas by effective bilateral engagement between authorities, especially that of Gulf countries. Madam, the loans availed by those who passed away due to COVID must be either write-off or moratorium on interest payment is affected. Madam, the Pravasis, including nurses, executives, professionals, among others who want to return to their employees, and I am concluding, to lose their employees to host companies, easing of the pandemic must be helped in the bilateral effort, and steps must be taken to ensure all support for them. I would also invite your attention through you, madam, the fact that since the pandemic has receded, there is a rush to renew the reissue of passport, especially in Kerala, and since the passport officers are unable to meet the demand for reissue, renewal, fresh application of Pravasis, the government must deploy more employees or add manpower in various passport offices in Kerala, passport circle, to help meet the demand. Madam, the volunteers who work in the COVID brigade should be absorbed in the health department so as to serve as a reserve and experienced workforce at disposal in the eventuality of COVID pandemic and other such a situation. Madam, ASHA workers, that is very important, madam. ASHA workers who were frontline workers on COVID pandemic must be absorbed in the health department and their services are utilized in the country to meet public health crisis. The local
Shri Abdul Shamad Shamdani ji.
yeah, madam, I'm finished.
Shri Abdul
But
Shamad
I am
Shamdani ji.
concluding. Madam, the local government institutions have spent lot of funds from their own pool to tackle the COVID pandemic, and now they are in difficult situation to meet their day-to-day needs. The central and state government must reimburse and compensate their resources deficit by special allocation by the union government. Madam, the offline education method used during the pandemic, online education during COVID period must be made a permanent solution, and infrastructure facilities including smartphones, tablet, smart televisions, telecom infrastructure, including mobile towers, boosters and cellular towers must be made permanent, keeping in view of the possibility of increased access to digital education, especially for the tribals, Dalits and students from remote area, so that they will no longer suffer the way did not COVID period accessing education. Madam, in health sector, Madam, I am concluding. In health sector, by taking note of the effect COVID pandemic in Kerala, sanctioned a All India Medical Institute for Kerala state must be allotted immediately and order passed in this regard. Thank you, ma'am.
Thank you.